A warm welcome, please, to Bill Gates, co-chair of the Bill and Melinda Gates Foundation.
Chancellor Scholz, Director General Dr. Tedros, Dr. Priest, thank you for hosting us today and for inviting me to share a few words with this esteemed audience. In my life, I've been very fortunate to participate in two societal revolutions. Twice, I've seen almost impossible ideas become reality. The first was 50 years ago when Paul Allen and I founded Microsoft, and we dreamed of a computer on every desk and in every home. At that time, many people thought that was crazy, that it'd be impossible. But today we've gone even beyond that, where everyone carries almost a supercomputer in our pockets. The second societal revolution began about 25 years ago when I was transitioning to my second career in philanthropy. At the turn of the century, I was stunned to find out that nearly 10 million children were dying before they reached their 5th birthday. I was a new father at that time, and when I saw that number, I was horrified. Back then, the idea that we'd be able to cut that death toll in half seemed as impossible and idealistic as the idea of personal computing. But in fact, that's exactly what happened. A single generation later, the number of kids who die before age 5 is now less than 5 million a year. And I consider this I think we should think of this as one of the greatest achievements in human history. And it's no coincidence that this revolution in global health began around the same time as we started several new global partnerships. Gavi, the Vaccine Alliance, the Global Fund to Fight AIDS, Tuberculosis, and Malaria, and the Global Polio Eradication Initiative have collectively saved over 80 million lives. And of course, the World Health Organization has played a central role in every major global health achievement of the past 75 years. The global eradication of smallpox, still the only human disease we've eradicated. The near eradication of wild polio, where we're down to just now 2 countries that's left. The response to COVID-19. Today, WHO continues to play a crucial role by gathering essential data on disease outbreaks and vaccine coverage, providing technical expertise, coordinating emergent responses, and setting the standards that other health institutions rely on. We need the WHO to make sure that our risk of pandemic is kept very, very low, because we saw what the cost of a pandemic was. The things WHO does, no country can do on its own. Together, WHO and these organizations provide a comprehensive approach to global health, alongside partners like the World Bank's International Development Association. They are responsible for the unprecedented progress. So global challenges need global solutions. And when we pool our resources, we bring together the expertise across sectors and geographies, we multiply the impact of those resources many times over. The Gates Foundation has supported global health R&D and health institutions as its top priority since its inception. And as we'll be celebrating our 25th anniversary next year, we'll make it clear that our support for these organizations is the best money we've ever spent. And I believe that the citizens of every donor nation should feel the same way. But we should not feel complacent. The fact that childhood deaths are under 5 million a year is an achievement, but it's still 5 million children, and I think we can all agree that that is far too many. It's been a quarter century since I was a new father, wondering if we could cut it in half. Today, I'm a new grandfather, wondering if we can cut it in half again. And the answer is that if we're focused, if we prioritize this, we can. Now, sadly, I don't think this is going to be easy. We do have on our side lots of new innovations, ways of preventing women from getting cervical cancer, the HPV vaccine, ways of preventing women from getting HIV, a shot that you only have to take twice a year, a trial of a TB vaccine. I could go on and on. The innovation pipeline is as strong today for health and malnutrition as it's ever been in any time. The limiting factor, therefore, is not the science, it's the funding. After decades of expanding, funding for global health is now contracting. This year, amongst the top donors, including EU, Germany, France, the US, and others, over $9 billion has been cut from aid budgets. I understand the budget pressures, I understand the reasons that happened, but that really challenges us. And we really need to make the case that ideally over time, as there's flexibility, these budgets go back to the increases that we saw before. And, of course, we need this money to be focused on those most in need. These health challenges are made even worse by climate change. And in fact, the best way to help support climate adaptation is the aid generosity in areas like health and in agricultural innovations. We have seen the share of aid going to Africa has gone from 40% to just 25%. And so it's going to require us to drive the innovation faster and to make the case that over time the resources are needed. We see challenges. The pandemic was an interruption. The financial condition of many of these poor countries is tougher than ever. And so this, if we're not careful, we will reach a plateau. We saw an example of that where in Gaza, we saw the first case of polio in over a generation. And so how do we think about this? Well, these great new tools are here, tools that can help mothers survive pregnancy, tools that can make sure kids grow up and their body and their brain develops fully, so not only for themselves but their country. They can get out of the poverty trap. They can do what we've seen many countries in Asia do, which is grow their economy and become self-sufficient. Today, India, Vietnam, Indonesia are examples of countries with over 1.8 billion people who are now independent and funding most of their own health system. We do have great vaccines coming along like RSV. We've got the HPV vaccine that will protect a generation of girls from cervical cancer as we receive appropriate funding. So we have to prioritize and we have to get these tools to the people who need them most. We know that investing in global health institutions produces very measurable results. Cynics who say, hey, does aid really have impact? We have very clear answers, very well-known data that these healthy children, they survive, they attend school, and they lift their countries up. Every dollar invested in global health produces over $20 in returns from increased productivity, lower healthcare costs, and economic growth. And that's something we should all celebrate, whether it's the moral cause of helping our fellow humans, whether it's creating stability to avoid unrest, whether it's growing the world economy, whether it's preventing pandemics from breaking out in these countries that are not detected, that we saw was bad for the entire world. There are many, many reasons to stand behind all of these institutions. Our foundation has supported global health for decades, including the WHO. In fact, since 2019, we've granted an average of $260 million to the WHO every year. And we like to make our grants as long as possible, typically 3 years or more. These multi-year commitments are the best way to support the organization because it gives them a clear roadmap to build up the capacity and really do their very best work. I'm really excited that donor nations here are committing to both increase assessed contributions and voluntary contributions. After all, the World Health Assembly sets the WHO priorities, so it really is the member states that are stepping up for that funding. I'm thrilled to see, I would be thrilled to have other nations provide even more, passing the Gates Foundation in the WHO donor rankings, because that would mean more lives saved. So this progress towards the UN goals, the Sustainable Development Goals that include that idea of cutting childhood deaths in half are very exciting. We've slowed, but we can go back to accelerating. Leaders, hopefully they'll speak out because this is not bleak news, it's very good news. We don't want to turn the clock back in any way. We want to move forward and have these incredible improvements. So I want to thank all the leaders here stepping up to seize this opportunity. Thank you for your commitment to realizing a better, healthier future for people everywhere. Thank you.
A top donor to the organization's Fund for Emergencies. As a sign of that steadfast commitment, we're joined by the Chancellor of Germany, Mr. Olaf Scholz.
Director General Tedros, Bill Gates, Minister Lauterbach, Karl, Excellencies, ladies and gentlemen. Whoever saves one life saves the world entire. Most of you are probably familiar with this maxim from the Talmud. Saving as many lives as possible is what the World Health Organization aspires to. One number reflects just how lofty this aspiration is: 40 million lives. That is how many lives the WHO will be able to save over the next 4 years. Because there are more vaccines that protect against serious diseases. Because there is better access to doctors, nurses, clinics. Because medical staff receive more professional training. Because meaningful data is collected. The World Health Summit each year shows how far we have come and what must be tackled next. With the money that we collect at this pledging event today, we can enable many women and men, and above all children, to live healthier lives, with less pain, fewer infections, less suffering. Many thanks to coming to Berlin from around the world to be here. I join in bidding you a warm welcome. One very recent example illustrates how important the World Health Organization is. In August, there was an outbreak of mpox in Central Africa. This disease is particularly dangerous for people who cannot access clean water or reliable medical care, who do not have space to isolate, who have weak immune systems. The World Health Organization sprang into action following the outbreak and declared it a public health emergency of international concern, the highest level of alarm. This shows how swiftly the organization can act. After providing initial emergency assistance, the WHO called on the research community to share data and on countries to donate vaccines. I'm pleased that the German government was immediately able to offer 100,000 doses. Vaccination campaigns are now being organized on the ground and staff are being trained to carry them out. Together with UNICEF and Gavi, the Vaccine Alliance work is being done to ensure that everyone can be safely vaccinated with clean needles, vaccines kept at the right temperature, tents, qualified staff, and campaign. The alarm levels help all countries to better assess emergency situations such as the mpox outbreak and to make decisions accordingly. In May this year, at the last World Health Assembly, we improved the categorization of the alarm levels and made specific adjustments to the international health regulations. This is particularly important for tackling the most serious diseases there are: Ebola, mpox, the Marburg virus, and polio. This enables us to better tailor our response when something happens. We live in a deeply interconnected world. Aeroplanes take off every second, transporting goods and passengers around the globe. Sometimes they also carry viruses on board. The COVID-19 pandemic made it definitely clear that an outbreak of infectious disease anywhere in the world affects us all. Pandemics do not stop at borders. This represents a global challenge, one that we can only properly tackle together. And so we are continuing to campaign for an international pandemic instrument to be concluded sooner rather than later. An instrument that should improve prevention and preparedness, as well as enable us to respond more swiftly to pandemics and cooperate more closely with other states. This is important. The World Health Organization's work benefits us all. What it needs for this work is sustainable financing that gives it the certainty to plan ahead and the flexibility to react. I'm therefore pleased that the member states have decided on a gradual increase of their assessed contributions. This will partially cover the 14th General Programme of Work. We have to find other ways to fund the rest. This includes making good use of synergies with other stakeholders in global health, such as Gavi, CP, and the Global Fund. Recently, just a handful of countries have provided large amounts of funding. It would be better for us to spread the responsibility across many more shoulders. Every contribution counts, no matter how small. Ladies and gentlemen, that is why we have invited you to this pledging event. I'm especially pleased to see that both old acquaintances and new donors are prepared to support the World Health Organization. My thanks go to the Wellcome Trust as well as the Gates Foundation for their unwavering efforts. Bill Gates, your goal and your foundation's top priority are to eradicate polio. Your decades of tenacious work show how difficult this is. But thanks to everything that you and your fellow campaigners have done over the last years, we are better able to fight many other infectious diseases too. I would like to take this opportunity to say to you in person, most sincerely, thank you so much. And I thank all of the states, foundations, and business representatives who have made pledges here in Berlin today. Germany too supports sustainable financing for WHO. And so I'm pleased to be able to share with you today that Germany will be providing the World Health Organization with a total of at least 360 million euro for the next General Programme of Work. Together with our French and Norwegian friends, I appeal to you, join us. Let us support the WHO together. Let us save lives together. Ladies and gentlemen, this pledging event is a great success. We have built trust for a healthier world, and we will continue to do so. And so I say to all of you, From the bottom of my heart, thank you very much.
Thank you for watching Health Bulletin. Don't forget to subscribe for more updates on global health and science.